Dr. Hart.
Hi, how are you today?
Good. So many people have migraines. You have been treating a lot of patients with migraines, right? And what causes that? What's the mechanism?
There are spasms and vessels in the brain. It affects the surrounding tissue and causes pain.
Okay.
Interesting, if you look worldwide of patients' problems, number one problem in the world is migraine. Number one is back pain. Number two is headache, of which a good percentage of them are migraine.
Yes, yes.
And when you treat migraine, there's two parts of the treatment. One is you treat the headache.
Yes.
When it comes. And the second, depending on the frequency of the headaches, you do preventative treatment.
Okay.
So if somebody is getting one migraine every 6 months, in the traditional medicine, would you want them to be on a pill with potential side effects for 12 months to prevent 2 headaches? Which is different than if somebody's getting 3 migraines a week, which can happen.
Yes.
And then, yes, it would be worthwhile to prevent it. And there are many triggers for migraine. Some people are triggered by fatigue. They're staying up too late. They don't sleep well. Some people have triggered by the weather, changes in the weather. They notice a storm front coming through, they get a migraine. There are food triggers, stress triggers. There's many triggers, and some people can have a number of triggers, and some people can't even figure out what they are. But it's interesting, when we treat anything in medicine, what's important and what guides myself as a physician and you as an acupuncturist are the studies that are done with patients. And you don't want a study that is done with 3 or 4 people. You want a large study, and you want a reputable institution.
That's right, yeah.
So if you look at migraines, there are some excellent studies, including people like the Mayo Clinic, who have said that acupuncture is very effective in preventing migraines in patients who have it. And the wonderful feature is, it's not a drug. The medicines that I use, because I don't know how to do acupuncture, of course, but the medicines that I use can help people, but there are potential side effects.
Yes, that's right.
And so that is one of the wonderful features about acupuncture, that somebody can go on a course of acupuncture, prevent the recurrence of the migraine, and even help sometimes if you happen to be getting a headache when you're at your acupuncturist with the treatment of the headache.
That's right.
Yeah.
So the drug, what kind of mechanism the drug would relieve? I know some people saying that they use coffee to help their migraine.
Well, one cause of migraine is caffeine withdrawal. You know, the person who takes 3 or 4 cups of coffee a day and then suddenly for some reason stops the coffee, they can get a migraine and they take it. But the medical treatment, the drug that is recommended, is called sumatriptan. It's a class of drugs that are called triptans, and they are the treatment of choice. They're not a pain med. So sometimes people, when they get migraine, take ibuprofen, they'll take an aspirin, they'll take a Tylenol. Yes, those are pain relievers, but they're not targeting the cause. The sumatriptan goes into the brain and targets the actual underlying mechanism.
You mean tryptophan?
Imitrex, which is a triptan, completely different thing. And there are many preventative drugs. Years ago, there was a class of medicine called a beta blocker, which came out to check blood pressure.
Yes.
But they found that this drug can also, in a percentage of people, prevent migraine.
Okay.
But there are other drugs as time's gone on, because migraine is so frequent, that no medication, unfortunately, works for everybody.
Yes.
So you have to have a number of choices. And that's no different if you're treating high blood pressure, diabetes, or migraine. But again, going back, one option for people who, some people are very sensitive to medication.
Yes.
For example, the name of one of the drugs is called propranolol or Inderol, is one of the common medicines used to prevent migraine. Well, side effect is sedation.
Yes.
It also lowers your heart rate. and lowers your blood pressure. So if you've got normally a lower blood pressure,
Like me.
you can have a possible consequence of getting too low blood pressure, feel faint, lightheaded, it can slow
Yes.
down your heart rate.
That's right.
And another side effect is if you're exercising, you check your pulse, it stops your pulse from racing. So you can't use your pulse as a guide to are you exercising to the right level.
That's
That
right.
doesn't mean we don't use that medication, we do, but that's not a side effect of acupuncture.
Yes.
Um,
Do you think that's what I'm thinking, because I'm very sensitive to drugs, and if a person have acute migraine,
mhm.
then they're gonna take the medication. When it's not so frequent, they can use the acupuncture.
They can use
to
the
prevent
acupuncture. Oh, sure. And I mean, I've seen people who get 3 and 4 migraines a week, a month, and the migraine is probably the most severe headache we can get. There are other causes of headache, tension headaches, a sinus problem, from some allergies, which causes that. So migraine is not the only type of headache, but as far as intensity goes, it's considered, a very severe headache. And somebody who has migraines, they want to be in a dark, quiet room. They want to be isolated. They can't function. So if you get a migraine and you're at work, it's very hard.
Yes.
So if you can prevent that headache, it's really the best treatment is to prevent it from coming in the first place.
Yes. So we have to combine different treatment
Right.
modalities.
And there's no harm in adding
Yes.
one to the other. So for the acute treatment, yes, it's nice to have the medication.
Yes.
And again, that medication works for a lot of people, but not for everybody.
That's right. Yes.
So for people who have migraine, they may want to look at combining what they're doing with acupuncture, and if acupuncture is working, cut down on the medicine they're taking.
Yes. I think that's good strategy.
Yeah.
Thank you.